When hormonal tests are done and the results come out and they are not within the normal range, it is said to be hormonal imbalance. Remember that it's not only one hormone that is analyzed, there are quite a number, especially when we are evaluating for infertility. So whenever any of them or more than one are not within the normal range, then we now say the hormones are not balanced, hence hormonal imbalance. Hormones are chemicals that help to regulate how the body works. It is not only in fertility that hormones work. In all parts of the body, there are different types of hormones that help to keep the body going, and they are specific per the organ or any part of the body. So for reproductive evaluation, there are certain hormones that we check to know whether the person is ovulating well and how the person is doing, to know how the fertility potential, to be able to assess it, to know how the person is doing and how to help the person in that regard. So when the results are not okay, then the gynecologist comes in to see how it can help, either to correct the imbalance so that the patient will not be able to achieve pregnancy in that regard. Hormones are seen in everybody, both men and women. So depending on what we are evaluating for, we test for those hormones. A client presents maybe because of inability to conceive, or maybe the cycles are irregular, or she feels she's not ovulating very well, for whatever reason. We try to, part of the test that we do when we are evaluating for infertility, we check the hormones. And when these hormones are checked, to know what is really happening down there. Most of these hormones are produced in the brain, but they control the reproductive, the normal reproductive organs in terms of ovulation, as well as the cycle, regularity, and all that. When the results come out, if there is a reason, sometimes it may be too high or too low. So depending on the hormone, the gynecologist will now decide to give medication, offer advice. From there, the mode of treatment will now continue. Sometimes there are no signs. Most times, in fact, there are no signs. Probably find out that I have not been getting pregnant of late, or my cycle length has increased or decreased, or based on my calendar is no longer as regular as it used to be. Then you begin to wonder what the problem may be. But most of the time, clients come in if they feel that they've waited for some time to get pregnant and it's not happening. So that is the beginning of the evaluation. Checking the hormones, whether there is a reason for there's a need for augmentation of those hormones so that we can enhance the fertility potential. But in this case, remember that while you're checking the hormone, you're also checking the man. The components of hormones that are analyzed in the evaluation of a client who is trying to get pregnant affects ovulation, especially. So when the results come in and it suggests that ovulation is not right, there is no way the patient or the client in this case can get pregnant, because if ovulation is not complete or is not enough, pregnancy cannot occur. Ovulation is just the process of egg release in the middle of the cycle. So if the eggs are not released, there won't be any pregnancy. Okay, whenever there is someone misses her period, we do a pregnancy test. If it's negative, then it may be said to be delayed period. It doesn't necessarily mean that there is a problem. We may just reassure the patient and tell her, okay, let's see what happens in 2 weeks' time. The period may just come on its own, then to reset by then the next month it will now come like 28, 30 days after that one that came. It doesn't necessarily mean there's a problem. It's only when it becomes persistent, maybe the duration in between two successive periods is longer than 35 days, and it becomes persistent 3 months to 6 months, then there may be a need for evaluation if pregnancy is not coming. Some people have a cycle length of 35 days and they still get pregnant, or even more. So it's just about, okay, we are not getting a pregnancy and we are having this long delay, then there will be a need for evaluation, usually after 3 months, because stress can delay periods, and when the period now comes, it may not, it's just a random, it's seen as a random event. It doesn't mean that it keeps on coming like that. It's only when it keeps on coming and keeps on happening, that's when the doctor will now have to intervene in this case. Okay. Hormonal imbalance, when that diagnosis is made per se, it depends on the time that the blood sample was taken. That's what you are going to get at that point. But in some situations, if the doctor feels convinced that there may not be any need for any intervention based on what is seen, because some levels may just be slightly higher or lower. It's only when it's very high or very low and it's not associated with a particular symptom. In this case, I'm trying to get pregnant, I'm not getting pregnant, and there may be a need for intervention. In some cases, there may not be any need for any intervention. You just wait it out, maybe repeat it after a month or two and see. If it remains the same, then you may need to intervene in this case. That will be all for this week. Till next week, where we continue to address your health and fertility concerns. Don't forget to subscribe and turn on your post notifications to get updates on our new videos.